My name's Adrian, and I am 10 weeks along with my second child. And I got a copy of Ina May's Guide to Childbirth a few weeks ago and read it cover to cover in about a week, even with a toddler or preschooler on my hands. And it was a really great book for me to read because I was not entirely satisfied with my hospital birth with my daughter, and a lot of it had to do with anxiety around pain medication, the pain of delivery and labor, and it helped me to not be afraid of what was going to happen to me. And having been through the experience once before and realizing that I probably didn't need everything that I had elected to do in the hospital has led me to make different decisions the second time around. So we'll be planning to do a home birth. And I really feel that the book, as well as talking with moms who have been through it before, giving me the confidence in, to make the choices that feel right for me, and that I don't need to be afraid of it. For me, anecdotal experience is really powerful, and so hearing all of those birth stories, was the first thing that really struck me. That it made me realize that for millennia, women have been doing this, and that the medical interventions have only occurred in the scene in a blip in time over the last 50 years or so. And reading more about the physiology in the second half of the book, that it all made sense, it all clicked.
I'm Amy, and this is Rory, and he's 6 months. A friend of mine who was also pregnant at the time told me to read Ina May's Guide to Childbirth, not just because it's inspirational, but most importantly because it's so empowering. And you feel like, I'll be able to give birth to this baby even if I'm all alone in the forest with nothing but a stick to bite down on. The best thing that it did for me is it gave me the courage to stand up against the techno-medical model when I wasn't comfortable with what was being thrown at me. A few days before he was born, as a first-time mom, I panicked a little and I went into the hospital a little early. And while we were there, his heart rate decelerated. And the nurses all freaked, and they called the doctor, and the doctor said, "We're recommending a C-section." And the nurse told me this, and she looked at me and she looked at my husband. She says, "Do you want me to give you some time to think about it?" I looked at my husband, I looked at her, I said, "We don't need any time, we're not doing it." The book starts out with a whole bunch of different birth stories about lots of different moms, lots of different situations, different bodies, different ages, and then after all those inspirational stories, we get to how Ina explains, how you can help yourself have the birth that you want, and that your body is not a lemon, and it can do this, it's a natural process. And the way that the medical people look at it is not that way. It's more sees it as an illness to be handled, to be treated. So just to be able to listen to what they're saying, but then say, wait a minute, I know my body, I know my baby, we've spent 10 months together already, and I think we can handle this.
My name's Desiree Johnson, 15 weeks in my second pregnancy. The statistics that she had at the end of the book with the low rate of complications that they actually had at the farm was both encouraging to me and also in a way discouraging, as far as they're much higher than that anywhere else. But I think that it's just one of those things that it's worth examining what they do differently there as opposed to the standard care that most women receive, and how that can affect the birth in a positive way. She talked about arm wrestling to help labor progress, because it could help your thigh muscles and your pelvic muscles relax, and that was just something that I had never ever come across before in anything that I've read. And I've done a lot to educate myself as much as I can, and I've never heard of that before. But it's something that I'll think about the next time if I'm having any trouble progressing, I guess.
I'm Kat Kutcher, and I am 38 weeks pregnant with my first child. I really loved the birth stories in this book. I learned that even with the same mom, every birth is different. Every child's birth is different. And that birth is normal, it's natural, it's healthy, it's not a state of pregnancy is not a state of disability or disease, that this is actually a really great process. I also learned a lot about the midwifery model of care versus the medical model of care. I was leaning more towards the midwifery model anyway because of my interest in holistic medicine and natural health and all of that. But I felt like I learned a lot more about that from this book, and I really felt, you know, more confident about working with a midwife after reading this book. She just has a lot of really awesome wisdom in this book based on her experience. And I think too, learning about the midwifery center at the farm and learning what good results they've had, comparing to, you know, other midwifery practices and other OB practices throughout history, you can see that midwifery is really safe. Really helped me to think about, well, to educate me about the whole process of birth. You know, I wouldn't have known what kinds of questions to ask, you know, or even to think about things like psychological hang-ups that I had and how that could stall the process of birth. You know, and it's really helped me to kind of see my midwife not just as a medical provider, but as a counselor. If you want a birth experience that's going to be really empowering, where you're going to be making informed decisions, whether it's in a hospital, whether it's in your home, whether it's in a birth center, wherever you decide. But if you want to be someone who's actively involved in that process, that this book helps you to figure out what kind of birth plan you want, what kind of experience you want.
My name's Liz, and I am 28 weeks pregnant with my second child. Yeah. Was eye-opening as far as how much alternative care there is out there other than your standard, you know, hospital type, you know, care models. And I had known that, but I just hadn't learned that prior to my first pregnancy. I feel like I bought all the books, but I bought all the mainstream books that kind of told you about, you know, the ins and outs of you know, the medical hospital model of care. And so for me, it was just affirming knowing that there is this whole other community of people that believe a different way and believe to trust your body and that our bodies are made to birth, and just I learned, it gave me confidence in that, you know, yeah, I can do this. I don't need, you know, all these other interventions and things to feel like that's what I need to give birth. The book reminds you how we gave birth as a species for, what, thousands and thousands of years without any medical and, you know, intervention, and we are still here today. I mean, obviously our body and the cultures that have progressed over time have trusted their body, and so kind of the book kind of highlights that and reminds you of that and kind of brings that to the forefront, and it kind of gives you this new perspective on how you can do that too.
I'm Danielle Anthony, and I am 25 weeks pregnant, and this is our first and only baby. Before I read the book, I had a pretty analytic hospital, a birth story, the TV show. I thought all birth was painful. I thought all birth required epidural. I thought it was something to be very afraid of. One of the main impacts of Ina May's book was those birth stories that just made it, I mean, it was just natural, and the women seemed happy, and it was no big deal, and there was not death, and there was not fear, and the pictures just show the men in the room, and it wasn't medicinal. And so that caused me to look into hypnobirthing and to try to find a doula, or look into home birth. Immediately after reading the book, I called to the home birth people in town and interviewed them. I didn't know that I could have a birth plan, and I consider myself pretty educated. But I learned that I have a choice on what I want done the day of the birth. I'm thankful that I was given that book. I would not have picked it up had it not been given to me.
but I read it immediately. I think I started reading it that night and just couldn't put it down. I mean, it really, really changed the way that we're going to have this baby. And I'm thankful for that.